يفقهوا قولي اللهم إني أسألك علما نافعا رزقا طيبا وعملا متقبلا شفاء من كل داء. This is Dr. Zunaira Faiz. Today the topic of discussion is endometriosis. Definition: a benign condition in which hormone-dependent endometrial glands and stroma they are present outside the uterine cavity and wall. Its importance is due to its distressing symptomatology, association with infertility, invasive potential, difficulty in diagnosis. Incidence: it is estimated that 5 to 15% of the women have some degree of disease. Age: it classically present in nulliparous infertile women in their 30s. Pathogenesis: is it not fully understood? However, genetic predisposition, immunological changes have been reported to clearly play a role. Several hypotheses have been used to explain the various manifestations of the disease and include the retrograde menstruation theory, when there is menstruation and they think that the blood is passing back towards the fallopian tube and then in the peritoneal cavity. The Mullerian metaplasia theory, the lymphatic spread theory, the hematogenous spread theory. Sites of occurrence: most commonly found in dependent portions of the pelvis, ovaries 2 out of 3 women with endometriosis, then broad ligament, peritoneal surface of the cul-de-sac, that is uterosacral ligament, and posterior cervical ligament. Rectovaginal septum less frequently involves the rectosigmoid colon, appendix, vesico-uterine fold of peritoneum, laparotomy, scars. Here in this picture you can see this bluish, this dark purple dots, they are pointing towards the sites of the endometriosis: sigmoid colon, ovary, broad ligament, uterosacral ligament, rectum, cul-de-sac, rectovaginal septum, cervix, bladder, round ligament, appendix, and umbilicus. Pathology: the islands of endometriosis, they are sensitive to the ovarian hormones. Estrogen causes proliferation. Regression of corpus luteum and removal of estrogen and progesterone causes them to slough. These sloughed debris induce a profound inflammatory response that causes significant pain. Endometriosis of the ovary: these are cysts filled with thick chocolate-colored fluid which may have black tarry cyst consistency. This characteristic fluid represents aged, hemolyzed blood and desquamated epithelium. The glands and stroma lining the cyst wall may be destroyed due to an increase in pressure. Risk factors for endometriosis: nulliparity, infertility, reproductive age, usually teens to 40s. A first-degree relative with endometriosis is also the risk factor for endometriosis. The characteristic triad of symptoms: number 1, dysmenorrhea; number 2, dyspareunia, that is painful coitus; and dysgeusia, that is, it is the pain during defecation, may or may not be associated with bleeding during defecation. Possible sites of endometriosis: again in this picture you can see intestines, appendix, round ligament, uterus, bladder, cervix, vagina, anus, rectum, colon, uterosacral ligament, ovary, fallopian tube, lining of the pelvis, and ureter. Other symptoms: pre and post menstrual spotting, cyclical pelvic pain, low sacral back pain, infertility if the bladder is involved, cyclic hematuria, dysuria, ureteric obstruction if rectosigmoid colon is involved, premenstrual tenesmus and obstruction. Tenesmus, it is the condition, it's a feeling, may be constant or intermittent, and is usually accompanied by pain, cramping, and involuntary straining efforts. It can be temporary and transient problems related to constipation. Signs: tenderness on bimanual examination, tenderness or nodularity on the posterior vaginal fornix, uterosacral ligament tenderness, cystic ovarian enlargement, fixation of adnexal structures, retroflexed uterus. Differential diagnosis: chronic pelvic inflammatory disease or recurrent acute salpingitis, hemorrhagic corpus luteum, benign or malignant ovarian neoplasm, and ectopic pregnancy. They are all differential diagnosis. History and examination, pelvic ultrasound, direct visualization of endometriotic lesions, pathological examination of the biopsy specimen, CA-125 levels frequently elevated in women with endometriosis, laparoscopy, laparotomy. Diagnosis. Definitive diagnosis is generally made by characteristic, gross, and histological findings obtained by laparoscopy or laparotomy. Endometriosis is not a clinical diagnosis. Again, we can see this is laparoscopy going on, laparotomy going on, and here we can visualize the interior of the abdomen and we can visualize directly the endometriotic spots. Here in this pic, directly laparoscopic view, we can see this is endometriosis and this is small bowel. Again, on histological appearance. Staging. American Society of Reproductive Medicine, that is ASRM, employs a staging protocol in an attempt to correlate fertility potential with a quantified stage of endometriosis. Here we can see the minimal lesions, mild lesions, moderate lesions, and severe lesions. Here we can see the red spots, only 3, and here you can see 3 to 7. Again, this is increased in size and also the quantity, and here in severe lesions, it is spreading all over. The American Fertility Society revised classification of endometriosis, that is, stage 1, minimal, 1 to 5 lesions, stage 2, mild, 6 to 15 lesions, stage 3, moderate, 16 to 40 lesions, and in stage 4, severe, that is more than 40 lesions. Again, their lesion size is also different, less than 1 centimeter, 1 to 3 centimeter, and more than 3 centimeter. Again, we can differentiate it by the adherence, flimsy or dense adherence. And again, we have to see on the ovaries, in the tubes, and in the peritoneum, all these lesions, whether they are superficial or they are deep. Treatment include non-hormonal treatment. If small lesions with mild symptoms and analgesia, prostaglandin inhibitors are given for pain relief. Secondly, hormonal treatment for severe symptoms, progesterone pills, that is gonadotropin-releasing hormone agonist, and then surgical treatment, conservative surgery if patient is young, radical surgery, that is total abdominal hysterectomy with bilateral sphingo-oophorectomy. And of course, we all love our homeland, Pakistan. Again, thank you very much. Jazakallah khair. Hope it will increase your knowledge.